Jessica and this is Jill. We are two of the nurse care coordinators at May-Grant. One of our main jobs is we get calls from the patients, and we're just going to go over a couple questions that we get a lot from our pregnant patients. And one of the things is cramping in pregnancy. So cramping is very common in pregnancy. It happens throughout. You'll have discomforts throughout, but there is a point where it becomes a problem. So the first thing to do when you have cramping in pregnancy is hydration. Drinking is always important, but especially in pregnancy because the uterus is muscle. And we suggest that you drink about a glass of water all hours that you're awake, so most of the time during the day. And then if that's not working and you're having cramping and the hydration is not helping, the hydration wasn't the answer, you can always, of course, rest. See if you're doing extra activity that day, rest, see if you feel better. If not, Tylenol is always an option you can go to in pregnancy. It is the go-to one, and just take it as it is noted on the bottle. If you tried all those three things not working, call us. We can definitely review it. And then Jill can go into the next thing.
So if you tried all those things and you're still contracting or cramping, give us a call. You can just call the office number. And we will talk to you about like how long it's been happening, what you've tried, and then we'll decide if we'll need to see you in the office or send you to the hospital, or any other recommendations. Something else that we would also want to know about is if you're having any leaking fluid. So of course your amniotic fluid could start leaking for labor. So if at any time you have leaking fluid that's like a watery discharge, or just something you're not sure about, call us so we can talk about it. Another third thing we want to hear about is if you have decreased movement from your baby. Starting at 28 weeks, we do expect you to have 8 to 10 movements in a 2-hour time frame. If you're not meeting that criteria, there's a fetal kit count that we would want you to do, and if you're not meeting that, then we would like to hear from you about that. The fetal kit count would be if you are, we want to make sure you're hydrated, just like Amanda had said. Make sure you're eating well. If you're eating, you should have protein at every meal and snack. So if you haven't had protein, try that. Lay down on your left side and pay attention to baby's movements. No phone, no computer, no TV, no other children around. Just pay attention to baby's movements and see if you're noticing at that point. If not, call us and let us know. Another thing we need to know about during pregnancy at any time is if you're having vaginal bleeding. There's different causes that could cause vaginal bleeding, and it's not necessarily a problem, but we always want to know about it so we can determine if it is or not. So again, you would call during office hours, you'd get one of the nurses, or you can even call after hours and speak with an on-call provider.
Yeah, and speaking of calling after hours, that there's so many questions that us nurses can answer during the day. Monday through Thursday, we are here from 8 to 5. Fridays, it's a little bit shorter, 8 to 3:30. And if it's during those hours, call us. We can answer urgent questions, non-urgent questions. If anything urgent happens after hours, you definitely want to call. At all times, you can call in. There's a midwife and a doctor on over at the hospital, so you'll call into our main number, the 717-397-8177, and then you'll talk to our answering service, and they will then page out to the midwife or doctor to then call you back to talk about any of those urgent problems that you have. If it's a non-urgent issue, if it's any time during the day, we have a great website with a lot of information on it that you can always look up. It has medications, what to do with heartburn, what to do with nausea, just a whole wealth of knowledge with pregnancy on there that you can look at any time.
Hi everyone, I'm Emily Burkholder. I'm one of the nurse practitioners here at May-Grant, and we were asked to give some answers to common questions during pregnancy that we often get at appointments. So I'm here to discuss 3 different common questions I get during the second trimester, which is kind of between weeks 13 and 28. These are common questions I get for women in that stage. One question I get a lot is, do I have to sleep on my back? People seem to really worry about that through pregnancy. the entirety of pregnancy. Ideally, after 20 weeks, we don't want you lying flat on your back at night when you're sleeping, on your left side or your right side, or even just tilted a little bit is fine. There's no need to panic about how you sleep at night. Typically when women feel, the issue is just with blood circulation, that if you're flat on your back, not everything, your body's not being perfused as ideally, and women usually feel symptomatic if that is the case, can feel a little lightheaded, but we just want you to sleep ideally on your left side or your right side, or just even with a couple pillows behind your head, so that you're not completely flat. So that's one common question I get a lot. You're not going to cause your baby any harm if you do wake up and you're on your back in the middle of the night. So there's no need to add that panic to already waking up in the middle of the night out of discomfort of being pregnant. Another common question I get is, should I exercise during pregnancy? And the answer is yes. It's great for you and the baby, for your health, and for your pregnancy. If you continue exercising during pregnancy, it's not the time to pick up a really vigorous exercise routine if that's not what you were doing before, but it's good to keep some level of physical activity. It's going to keep you healthier during pregnancy. It's going to help with the aches and pains of pregnancy, both whatever stage you're at, will help decrease how uncomfortable you get, and will help your labor and feel better again postpartum. So exercising, whether or not that's walking, whether or not that's, if you're a runner, you can keep running as long as you feel comfortable running. If you're a weightlifter, you can keep lifting weights through the pregnancy if that's what you're comfortable with. And again, if it's just walking or riding a bike, that's fantastic for you to do too. Again, not the time to pick up a huge vigorous activity if that's not what you're doing prior, but if your body's used to that, then it's good to keep doing that. Kind of on a perceived level of exertion, if like 0 is no exercise and 10 is working out as hard as you possibly could, we usually say don't go above a 7. So get a good workout in, but if your body's like, I gotta slow down, I gotta stop, you listen to your body and do that, and make sure you stay really well hydrated while you're exercising as well. Another common question I get with pregnancy is, or I don't get, but people often want to know, is what do I do about sex during pregnancy? Is it okay to continue having sex during pregnancy? And the answer is yes. There are a few complications with pregnancy we might tell you not to, but in general, the answer is yes. Though you might find that your interest in sex might change pretty significantly during pregnancy. It might go up significantly, it might go down significantly. Both are real normal to have some fluctuations in where your interest is with that, both due to the hormones of pregnancy and the discomforts and aches and pains as your body changes during pregnancy. Also very normal to feel really crampy after sex, so that often worries people, but that's just a normal response for your body during pregnancy for that as well.
So one problem that a lot of pregnant women have is constipation. They'll often ask me what they can do to help with that. Drinking lots of water is imperative for that, and it will also prevent preterm labor. When you're dehydrated, that encourages preterm labor. But the other important things that you can do is eat lots of vegetables and whole grains. That means brown rice rather than white rice, whole grain pasta versus white pasta, whole grain bread versus white bread. That makes a drastic difference. Pregnant women should eat somewhere between 5 and 10 servings of vegetables a day. So I always encourage that along with the whole grains. The other common question I get is about what is safe to eat while you're pregnant. A couple of things to think about is cold cuts always should be warm to steaming to eat. Fish is very healthy for baby's brain development. We encourage fish. There are 4 fish that you should avoid while you're pregnant. They are shark, tilefish, king mackerel, and swordfish. The other concerning thing when you're pregnant is raw milk, raw cheese, raw yogurt, raw meat, raw fish. Pregnant women are so much more vulnerable to the bacteria that's in them, so we want to make sure that you avoid any of those things raw. Raw fruits and vegetables, of course, are fine. It's just the things from an animal source that would be problematic.
Hi, I'm Dr. Meldrum. I wanted to take an opportunity to share or to answer a question that I get commonly in pregnancy. And that question is, what do I do about back pain? So first, why is it more likely to get back pain in pregnancy? Well, there's a couple reasons. First is physiologic or normal changes of pregnancy loosen up the cartilage in your joints, so they're more likely to rub together, and that can irritate your muscles, nerves, other things to cause that back pain. Second, your center of gravity starts to change in that 2nd and 3rd trimester. As you start to carry the pregnancy out, you naturally pull your spine forward, and it can cause some strain on your back muscles. And third, your gait changes. How you walk is totally going to change. So all of those can contribute to increasing your chance of hurting your back or to having back pain. The most important thing is good body mechanics. So avoid bending and lifting at the waist. Avoid twisting and grabbing things and picking them up. You want to turn your body to face whatever you're lifting and bend at the knees. Other things is you want to do lots of back strengthening exercises and stretches. There are a lot of resources online and on our website at May-Grant that can help you do these stretches throughout the entire pregnancy. So don't wait till your back hurts. And probably one of the most important things you can do in the second and third trimester is wear good footwear. So prevention is key. When you're picking those shoes or sandals to put on your feet, make sure they have good arch support, they have a solid or firm sole that's not going to slip, and that it straps on your feet normally so you can walk normally, so you don't have to change your gait. The most important thing, especially for the summer, is avoiding those flip-flops. I talk to every patient about this. Flip-flops are designed to cause you back pain in pregnancy, so it's best to avoid them as much as possible. And the reason is you don't walk normally, they have no arch support, they have very little cushion or no cushion, and again, you have to change how you walk in flip-flops to keep them on your feet, and that's very hard for your back and your spine. So flip-flops are only for very short trips, they're not for any long walks, and keep them to a minimum, or you can just wear comfortable sandals or slip-on type shoes or clogs. All of those are good supportive shoes that can minimize your risk of back pain.